This child's like 23, 24 years old, right? He's had seizures his entire life. And he's seen it at Johns Hopkins. He's been at Boston Children's. He's been all over the country. But there's one peptide that prohibits or stops this child from having seizures.
Wow.
There's only one, right? And Johns Hopkins is recommending that he use that, right?
Okay.
So this peptide is never shown to have any side effects or be harmful to anybody out of millions of use cases, right? So you would think that he would be able to get that.
Yeah.
You can use my daughters for a great example, who both have had congenital heart disease.
Wow.
Right?
Wow.
She's had 5 open hearts.
Wow.
Her last open heart, it was a failed surgery, right? And she was going to have to go back, or it was not an open heart. They tried to do it in a cath lab, right?
Okay.
And it failed, right? She actually coded on the table,
Aye.
right? So we thought we were going to have to go back for another open heart at Boston Children's. But we started giving her exosomes and peptides, and after 3 months, we went back in to get a checkup, and she had a 20% improvement in heart function.
Hi, this is Megan Nager from Coastal Pearl Podcast, and today we are sitting with Buck Andrews, who is the owner of Scale Regenerative Health, which is a company that is on the cutting edge of medicine, and it's going to be a really fascinating conversation. So I'm very excited, and let's dive in. So Buck, thank you so much for joining us.
Thank you, Megan, for having me.
Yes, of course.
Good to be
Welcome.
here.
Welcome. So tell us all about everything. Tell us about, I guess, what does Scale Regenerative Health do in simple terms?
Yeah. So we do regenerative and functional medicine.
Okay.
And we started with weight loss. We started with the GLP-1s, and we did that because we saw how many benefits they had just out of losing weight.
Mm-hmm.
There's just so many benefits to these peptides, right?
Yeah.
And so we've gone from there to expanding the business to incorporate a lot more, a lot of different types of medicine, helping people in a broad range of illness and longevity, metabolic health. So starting with weight, and then once we get the weight, get metabolic health in place, we have other programs that we'll start to introduce to make our clients healthy.
So would you say, there's a lot of like spas or clinics that are popping up, and they're doing the weight loss injections, GLP-1s, et cetera. What would you say sets you apart from all these other companies doing it?
So, we've been doing it for about 3 years.
Okay.
And we have a lot of experience with it. So, we will guide people from start to finish and these peptides, you start to get the receptors, start to get stressed. And so people hit these plateaus, right?
Yeah.
So we're very good at bringing people in that have hit plateaus and getting them through the plateaus.
On GLP-1s?
Yes.
Because I've heard that a lot too.
Yeah.
Yeah.
And getting them to where they need to be, right? So,
wow.
Yeah. So we do it all the time. We've seen clients that are 350 pounds, kind of get down 75, get stuck.
Wow.
And now they'll be like 220 and best shape they've been in their lives. It's so we see a lot of that.
Wow.
And we're able to guide people through those, difficult periods to get them to where they need to be.
Okay, love that. So why do people get stuck on the GLP-1s and plateau?
Right, because they're these peptides are meant to titrate up, right? Because your receptors start to get stressed. So when you get accustomed to them, right?
Right.
And if you look at the studies of tirzepatide, for instance, or Mounjaro, the highest dose is 15 milligrams. Right.
Okay.
But once you hit 10 milligrams, there's a diminishing return. So from 10 to 15, you're not getting the return that you would have gotten from 1 to 5 or 5 to 10.
Okay.
Right.
Oh, that makes sense.
Yeah. And so bringing other things into the picture can help to get through that. Instead of increasing the dosage from 10 to 15, there's better ways to get around it, to get around those plateaus.
Oh, interesting.
Yeah.
Okay. So it sounds like you guys are very involved and really can custom tailor, people's plans to what they need, basically. Yeah. You're not just handing them a GLP-1 and saying goodbye.
No, we're hands-on. We're very hands-on
yeah.
with all the clients. If they have a problem, they can come to us.
I love that. I'll be stopping in.
Right.
Okay. So peptides are, everyone's talking about peptides now. Obviously, that's what you specialize in. You just mentioned GLP-1s, which are peptides. Can you explain a bit about, simply what peptides are and some of the amazing benefits people get from them?
Sure. So peptides are short chain amino acids. There's been speculation on exactly how many peptides are in your body. Some people say up to 300,000, maybe more. Right.
So they're all naturally, they're in your body.
In the body. They mimic, there are natural peptides, but then there are also synthetic peptides that mimic the peptides in the body. So short chain amino acids mimicking, what's already in your body. And the reason that their safety profile is so profound is because they do mimic something that's already there.
Wow.
Right?
I didn't know that. Okay.
Yeah. So when you're introducing a peptide to somebody, they generally are very safe because they've already got it in their body.
It's not like a foreign thing you're putting in.
Exactly.
Wow. Okay. So, following that statement, a lot of these, I think people are skeptical. They're becoming less skeptical, I'd say, as time goes on. But, they're like, oh, well, these aren't FDA approved.
Yeah.
Do you hear that a lot? And then also, do you see, I guess, what are some ways that people could feel more safe without them being FDA approved? And do you ever see a way for them to be FDA approved down the line?
Yeah. So first of all, just to back up a little bit, these short chain amino acids are signaling agents, and they're not changing anything in the body. They're telling your body to go fix itself.
Okay.
And that's what makes them so extraordinary.
Right. Yeah.
And they're also, because they're they're similar to what's already in your body, they can't be patented. There was a law in 2012 that was passed that said, if you have something that's very similar, it's not unique enough to patent. So therefore, they're in kind of this gray area.
Okay,
right?
That makes sense, yeah.
And then there was a law in 2000, I don't know if you know, thalidomide.
Yes.
Right. But
they get those birth defects, right?
Yeah, exactly.
They gave kids birth defects? Okay.
So in 1962, there was a law passed there that said the FDA, had to run through these strenuous tests of efficacy, and safety. So you put those two together, and it puts these peptides in an area where you can't patent.
Okay.
Right, because they're not patentable.
Mm-hmm.
So nobody's going to pay the $4 million to apply to get to go through the clinical trials for these things.
It's $4 million just to apply.
Yeah. So it puts them in this kind of black hole, gray area. So even though they're very safe, most of them, there's been very little incidents with a lot of them, almost none with some of them that have been put on Category 2 lists by FDA.
Wow.
And we know because millions of people have taken these things.
Well, and they're in our bodies.
And they're in your body.
Yeah.
Right,
Which is so crazy because so many other drugs are approved by the FDA. And then you see those drug commercials where somebody's running around super happy. And then it's like side effects include seizures, death, aspiration and diarrhea, all these things. And then you have these naturally occurring substances that are not approved.
That's correct.
Yeah. Okay. So do you see yourself maybe getting involved in the future of peptide legality or
well, we're pretty involved in the treatment, so it would make sense that we would try to help. So there's there's hope. There's a kind of two ways that could potentially these things could go.
Okay.
Right. Congress could pass law making them similar to cannabis or right to try, right? Compassionate use.
Okay.
Right.
Okay.
So that's one way that could go. The second is, I don't know if you know, there's something called Chevron deference.
Okay, no.
It was a Supreme Court ruling in 2024.
Okay.
Right. And essentially it said that, the FDA can no longer write the law, enforce the law, and try the law. So, it has to go to the courts to be able to try the law. So there is potentially a way to challenge FDA on some of these.
Okay.
You could say, for instance, this particular peptide is used by millions of people.
Mm-hmm.
It's never shown to have any instance of causing anaphylactic shock or what the FDA says could happen, right? So why shouldn't this be in a situation where clients can use it if they want to use it? Because it can make them a lot better. It can make them a lot healthier.
And would you would go directly to the courts? Is that how that works? Or
Yeah, and that kind of in a case like that, it would have to be challenged by the courts. You'd have to challenge the FDA, get a group of people together,
wow,
and challenge the FDA. It's like some of the compounding pharmacies, because if you think about it, these compounding pharmacies are very safe. They have GMP clean rooms. They send everything off for testing.
Yeah,
it doesn't just go for sterility testing, but it goes for time interval testing. So it'll go, for potency, it could be 15 days, 30 days, 45 days, 60 days, 90 days, and these can come from FDA approved pipelines, right? So you could have a very safe method of delivering these to the public.
Right. Okay, so we can see you maybe getting involved in that in the near future.
Possibly, yes.
Okay, I love that. Because they really do need to. I mean, I know even just amongst people I know personally, more and more of them are waking up to, the benefits of peptides and more necessarily, Western pharmaceutical medicine.
Sure.
I just think it's slow, but it's getting more. I feel like in the next 5 years, people will really feel pretty comfortable with.
Yeah. Well, there's a lot of reasons it should be.
Yeah.
And I can give you examples.
Please, I was going to say, are there any, I'm sure you've had a ton of them, but case studies or just stories you've personally seen?
Yeah. So we have one client that's child's like 23, 24 years old, right? He's had seizures his entire life.
Wow.
And he's seen it at Johns Hopkins. He's been in Boston Children's. He's been all over the country. But there's one peptide that prohibits or stops this child from having seizures.
Wow.
There's only one, right? And Johns Hopkins is recommending that he use that, right?
Okay.
So this peptide is never shown to have any side effects or be harmful to anybody out of millions of use cases, right? So you would think that he would be able to get that.
Yeah.
I can use my daughters for a great example, who both have had congenital heart disease.
Wow.
Right?
Wow.
She's had 5 open hearts.
Wow.
Her last open heart, it was a failed surgery, right? And she was going to have to go back, or it was not an open heart. They tried to do it in a cath lab, right?
Okay.
And it failed, right? She actually coded on the table,
Aye.
right? So we thought we were going to have to go back for another open heart at Boston Children's, but we started giving her exosomes and peptides, and after 3 months, we went back in to get a checkup, and she had a 20% improvement in heart function. First time ever she had gone from one surgery to the next with improvement.
That's unbelievable.
Yeah.
Wow.
And so now she's like not scheduled for another open heart. We don't know exactly when she'll have to go, which is fantastic.
And did you find that yourself?
I researched what we could give her. Yes.
Wow.
Yeah.
Because I was going to say, for instance, like the kid with the seizures, how do you kind of, I guess you probably have ideas of which ones to try, and then you try them to see, is that how it works? Yeah.
Well, what's interesting about these peptides, one, they're just, I think, going to revolutionize, the medical industry.
Oh, yeah.
But then you combine that with the power of these large language models and AI, and you can have this amazing research capability.
Yep. Doctors better watch out.
Right.
Yeah.
So, we could be on the phone with somebody. We can be talking to them. They could be doing interviewing with the nurse practitioner. We can get their list of what ails you. We can literally, while we're sitting there, research what would be the best course of action or protocol for these individuals.
Yeah, because ChatGPT, I had I never get migraines. I had a migraine. I was looking up stuff to do. I would have run to urgent care or something. I was like, I just use ChatGPT.
Yeah, we use a lot of the different models. We use Gemini, we use Chat.
Yeah.
We use Grok.
Grok's good too. Yeah.
Well, Grok is especially good for blood tests when you get.
I didn't know that.
Oh yeah.
And it'll break down your blood test.
Yeah. So if you have a blood test,
yeah,
we've had patients will say, send us your blood work.
Yeah.
We have an ALS patient that came in the other day.
Wow.
Give us your blood work. We take that, we throw it right in the Grok, and it isolates exactly what are the markers that are most important for ALS.
My grandma passed away from ALS. It was brutal.
That's horrible.
10 years. It was just horrific. I've worked with the ALS organization a lot, and just it's just a horrific disease. But stuff like that, any type of neurodegenerative disease. So you're seeing help. You're seeing the peptides help those as well.
Oh, there's theoretically, there's never been any studies, but there were some studies. Cerebral lysin was done at and I think UMass.
Okay.
with fairly good results. There's some peptides that have been used in Italy,
Wow.
put together that have had, some results.
Yeah. Or at least like slow it.
Yeah.
Yeah.
I think the best they can do at this stage is try to slow the
Slow it, yeah.
progression. Yeah.
Wow. So that's another success thing is just you could treat. I mean, that's crazy. That's like unheard. That's unbelievable because really, there's not a lot of things you can do for it.
Right. Yeah. So that's a difficult one though.
Yeah, I know.
Lupus is another one that we've had great success with.
Wow.
That's a different one that we have been able to treat that. We've had one patient that had 2 weeks in bed, called. It's like, what can you do? And we gave her a peptide blend. With the next day, she was out of bed.
Wow.
Right, and feeling great. We've had women that have had double mastectomies, right? 12 years of having pain in the chest, and neuro pain. We have a blend that we gave them, a repair blend. Not just this one, but several patients now where they start doing this blend, and all of a sudden they're feeling much better. The numbness, the heaviness that accompanies the mastectomy goes away.
Wow.
Right. Yeah. So there's quite a few. We've covered seizures, covered heart, lupus.
This.
There's a number of.
Yeah, it's really unbelievable. So, okay, can you walk us through basically when a patient comes in, say I come in with, I don't know, I'm having like joint pain, headaches. I'm just throwing random stuff out.
Yeah.
I'm tired all the time. Kind of just talking about myself.
Yeah.
but so what would you do? Like, what's your process of basically figuring out what someone needs?
Right. Well, interesting. You talked about headaches. That's another one that we've had about 5 or 6 people that have come in with migraines.
Wow. Okay.
And
my husband needs that.
Right. And we have a blend that we give them for migraines that
Really?
we've seen like literally within minutes, the migraine go away.
Wow. And is that peptides?
From peptides. Yeah.
Wow.
Literally goes away. Right. We had one person come in that had shoulder surgery and couldn't get the hand past here. 2 weeks of PT. We gave him the repair blend. Comes back in a month later. He says, you know what? I've got full recovery.
Wow.
They said this was going to take 3 months. He says, but I had a side effect. And I'm like, uh-oh, here it comes.
Yeah. What's that?
And he said, well, I was supposed to go in to get a bridge put in my teeth, right? It was going to cost me $8,000. And after 3 weeks of doing these peptides for my shoulder, I looked in the mirror and my gums were growing back.
Wow.
I said, now I don't have to have the bridge put in. So we've had other people report this. My wife, as a matter of fact, we were doing it for her pain she has in the back. And she went to the dentist the other day and she had 4 5s. I guess they measured the gap. And the dentist said, you only have like 1s and 2s now. What have you been doing?
Wow. So it's like regrowing.
Yeah. So they systemically, these things they're signaling agents. So you don't have to get it exactly to the spot, right? But you could be putting it in your shoulder and it's signaling to fix your gums.
Wow.
Right? We have another peptide that's it goes out and it cleans out the senescent cells in the body.
Okay.
So I personally did that one because I had a lot of like I'm in the sun a lot, kite surfing.
Ooh, that's cool.
Yeah.
I did kite surfing once.
Oh, you did?
Yeah, in Spain, I got dragged across the sand for like 1.5 miles.
Yeah, you have to be very careful about where you do that.
I had a crew of people like chasing after me.
Yeah. No, that's
it was rough.
Yeah, you don't want to be around sand. It's best to be out in knee-deep water.
Oh my God, it was crazy. It was terrible.
Yeah.
It was cool. I mean, like kite surfing is cool in general, but
yeah, but it's got its risks.
Yeah. Oh yeah.
Yeah. It's a lot more risky than peptides. Let's just put it that way.
See, there you go. Yeah, they're not risky.
Right.
Yeah. So can you explain tell us again the name of the senescent cells?
Senescent. So your zombie cells, right? So your zombie cells, essentially what they do is they can clog up the mitochondria.
Okay.
We think mitochondria is one of the most important areas of what we do. We try to protect the mitochondria to improve the mitochondria because it's I guess a rising tide lifts all boats. So by improving mitochondria, we see improvement in so many different things.
Okay.
Right. So before we go into rebuilding the mitochondria, what we like to do is clean the mitochondria out first. So we actually have a New Year's program. We're doing a senescent cell cleanse.
Ooh,
right?
okay. So this is available until the 1st?
No, we'll have it available for
January.
anybody,
Okay.
but we're running a special like starting for New Year's, right?
Okay, go get it.
Everybody does their January,
Oh, yeah, they want to start fresh. Then
Yeah,
go to the gym
stop
and then they
drinking
stop
in
going.
January. We said we'll get your senescent cleanse in January, right?
Okay.
So it's a 5-day series is all it takes, right?
And you're not starving yourself.
No, you're not starving yourself.
I like that. Okay.
Yeah. And so what it does, it cleans out, gets the body to, there's something called P53, I believe, which it gets the body to release and clean out and release the senescent cells, the dead zombie cells.
Okay.
So we've also seen improvement in skin, improvement. I had like a really bad, in my ear. My ear was actually bleeding from, when you go to the dermatologist, you go in.
Oh, yeah. They zap
freeze it off.
Yeah, freeze it.
You go back in 4 months later, they freeze it off.
Yep.
You go back in, they freeze it off.
Mm-hmm.
Well, I got tired of going in and having it frozen off. Mm-hmm. So was researching this one peptide and tried it on myself first. This is like, old school doctors who used to try things first.
I love that though. It's like, that would be me. I'd be injecting.
Right. So we started trying it. Right. And it actually worked. It was like,
So is that for like skin cancer? Or?
Well, we wouldn't say just skin cancer, but we've seen significant improvement in skin.
Wow.
We had doing it not just as an injectable, but also topical. Right.
Okay.
So we had one client where we put it, he had a really bad spot on his nose.
Yeah.
And we put it on the nose and he had a pretty miraculous recovery in like just a day.
Wow. And again, that's peptide.
Peptide. Yeah.
So speaking of which, so one, you have this cleanse and you said you saw that from the cleanse, wow.
Right.
Okay.
So we did the cleanse, and then after the cleanse, we go into rebuilding the mitochondria.
Okay.
Right. So we have a peptide that will go into, there's something called cardiolipin. At the age of 18 on, you start to lose 1% of your mitochondria function per year on average.
Good thing I'm only 16.
Right.
So I got 2 more years left. Okay.
So by the time you're 70, you could lose 50% of mitochondria function.
That's crazy. And it's just people who aren't familiar with what do mitochondria do?
Yeah, mitochondria do everything. Just about they're
powerhouses of the body.
Powerhouse of the cells. They're in the cells. There's thousands. The density depends upon where they are, whether in the brain, which is very dense. Right. Where the cells are located. Right, and they control the cells. They provide. ATP is the energy of the mitochondria, right? And the mitochondria aren't independent. They communicate. There's like recent studies out saying that it's like a network of communication that's going on in the body. It's why if you stump your toe or broke your toe or you're walking on it, you feel the pain.
Yes.
All the way up. You feel bad.
They're communicating.
Yes, because they're all communicating.
So without 50%, I mean, that's like your body's not working as well.
Right. Of course.
Yeah.
Right. So that's part of the aging process.
Right.
So when you can slow down mitochondria dysfunction, and there is a peptide which goes into the mitochondria, and it's like fixing the engine. You fix the leaking gaskets of the engine, right? Mm-hmm. So when you fix the leaking gaskets of the engine, then it starts performing better. Right. And once you fix the leaking gaskets of the engine, then you have to pour the fuel in. Okay. So the fuel is the ATP. ATP is the fuel of the mitochondria. So we like blending nano NAD with different peptides.
Okay, because NAD is very anti-aging, correct?
It is, but we have our doctor, Mr. Lebon, or Dr. Lebon, has a patent on nano NAD, so it's much more potent. It has a longer half-life.
The normal NAD.
Yeah, the normal NAD. It's more potent. It's cleaner. It's yeast-based. It's not chemical-based.
Okay.
And we use that and combine that with a lot of our mitochondria peptides because what it does, it's not a 2 + 2 = 4. It's a 2 + 2 = 20. Right. So
this is all part of the cleanse, the new year.
Yeah. So once we do the cleanse, then we rebuild the mitochondria.
I got it. Okay.
Right.
Okay.
Right. And that's when you start feeling a lot better. You start feeling healthier. Your energy level goes up.
I love that.
And we've seen the athletic performance go up by 20-30% by just taking this peptide blend. Heart performance improves. Kidney performance improves. You can see the brain, brain fog, things like that. Exercise performance improves.
So speaking of all of these different peptides. Can you tell us the forms that they come in injections, but then you also have, are there pills and strips, or you brought something to show us?
So it's a lot of people don't want to do injections.
Yeah, I'm scared of needles. I'll still do them, but yeah.
Yeah, though there's a little 5/16 needle, you can't really feel them.
Okay.
But yeah, so we've been working. We have a partner that we work with, so we also have strips.
Wow.
That we're starting to carry.
And how do they just dissolve?
Yeah, so you put them just in the top of the mouth.
Okay.
And they'll dissolve in the mouth. And it has a special technology that makes them much more bioavailable. So when you do an injection, you're 100% bioavailable.
Okay.
So this is the reason, they're coming out with pill forms like with the GLP-1s, right?
Right, but I heard they're not as effective. Is that correct?
They're not. Well,
okay.
Here's the problem. So when you take something orally, it has to pass through the liver, right? And so oral is usually about 20% bioavailable.
Wow.
So to get like a GLP-1 that's going to be as bioavailable, you've got to take at least 10 times as much of it.
And then you're going to have more side effects.
And then once you take 10 times as much, you're going to have more side effects. Right?
Wow.
And you're not going to get the same efficacy that you do off of an injection.
So are the strips just as effective as the injection?
They're about 70 to 80%.
So a lot more than
what
a
it
pill.
looks. Yeah, and the half-life is pretty good. So but not all strips are equal. This particular strip and the woman that we work with that produces this, her name is Sarah Morgan, and Esther strips, and so we're partnering with her.
That's really cool.
Yeah, and so we do this as a means to provide
people who are scared of
an alternative to people that are afraid of.
I like that for me. So, and is that, because I've never seen those before, is that new?
Fairly new. This technology is fairly new, yes.
Wow.
Yeah. And in evolving, we're working with her with some different protocols and whatnot to put into the strips.
It's amazing.
So we're going to be working with her to put our nano NAD into that strip.
Wow.
Yeah.
The future of medicine is here. I feel like, do you think all the people in Hollywood and all these celebrities who are, aging very gracefully, obviously they can get plastic surgery and filler and Botox, but do you think they are doing all of this?
Oh, I know they are.
Yeah, right?
No, I feel like I know some of the doctors out there that are
okay, and they're all doing
actually treating some people that for HIPAA reasons I can't say who they are. Well,
right.
He couldn't tell me either. I wouldn't know. But
right.
But from what I've heard,
they do.
There are quite a few concierge doctors out there that are prescribing it, and you can tell by looking at somebody.
Oh well, yeah, they look incredible, and again, surgery obviously can help, but I just think some of it seems like it's even more than that.
Actually, you know what? I've seen, since we've had the business, people come in, no surgery at all. And then I've seen people that have had surgery. And our clients are looking better than the people that have had the surgery. And it lasts. It's not,
Well, because it's your body. Like it's from the inside out. You're not like just, artificially, I guess, fixing stuff.
Yes.
Yeah.
Correct.
Wow.
So yeah, it's a surgery. You go in, it's going to last for X amount of however.
And then you have to get it redone, and then
exactly. And the more you get it redone, the worse you look.
Yep. And then you can't smile or
Yeah.
Wow. Okay. Well, this is really cool. I'm really into this. So is there anything else you want to leave us with or tell people, obviously before they come see you, because everyone's going to come see him? I know I am.
Well, that's wonderful. We welcome anybody. We've got a wide range of people that we treat from.
I love that.
You're not. We have a 96-year-old that's on the tennis courts, 3 days a week.
Wow.
Down to people that are like 18, 19 years old that just need a little help.
Okay.
To get back into shape.
Wow.
So it's a wide range of clients and patients that we see.
That's amazing. So, and when you come there, do you meet with a doctor? Do you ask for blood work? Is it like a standard process?
So we have multiple layers.
Okay.
So they could come in, they could be just doing weight loss. They meet with a nurse practitioner for that. They could come in, they want a full functional medicine, right up, or they could be meeting with Dr. Laban.
So you can get a full workup, basically.
Yeah. So we have multiple layers.
Okay.
Okay. And we do multiple layers of different types of blood work.
That's huge
and
too.
expanding on that, right?
Well, because a lot of these clinics too, you'll go in and they just don't even ask you. They just throw you, here's a GLP-1. Like I've just heard that from a lot of people recently. Right. They're just getting them anywhere. Didn't check their blood. Didn't even check their BMI, anything. And they're just like, here you go.
Yeah, most of these a lot of clients that will come to us will have primaries, and the primaries will have already done the blood work. We'll just bringing your blood work when you
Oh
come.
yeah, if it's recent, right?
Yeah.
That's fine. Okay.
And then it's funny, once people get started, you can't believe the number of people that will come in, get started with weight, and then really want to improve their body, improve
Just
their
do other stuff. Yeah.
They want to improve their health span.
It's like a great gateway
Right.
drug.
So yeah,
Yeah.
exactly. It is a gateway.
Yeah.
We call the GLP-1s the gateway.
Do you?
peptides. Yes.
That's really
Yeah.
well. It's a good way to get, because I think people are so familiar with those,
Yeah.
and I don't think people realize they're a peptide.
Sure.
I didn't.
Yeah.
And then from there you learn all this other stuff. So it's a great way to get people in.
Yeah, it is. And then, from there, you'll see them start to improve their exercise habits. They'll start to improve their eating habits.
Wow.
Right. They really get involved,
Yeah.
in improving themselves,
That's great.
And those are like our best clients, the ones
Love
that
that.
start. And we have a lot that have started in very unhealthy positions. And, a year later, they don't even look like the same person.
Wow.
Yeah.
Well, that's perfect because it is the end of 2025, which is crazy. You can go into 2026 looking fantastic, feeling fantastic, right?
Yes.
And there's
absolutely.
a special being run on the New Year's cleanse. Is that correct?
Yes.
Okay.
Yes. And we have also a special to the end of the year, 10% offer.
Oh, okay.
Right.
All right. So you got what, like a week and a half?
Yeah.
That's crazy. I can't believe that. Okay. All right. So head in, and what's the best way for people to find you or get in touch with you?
Well, we have a website,
Okay.
scaleregenerativehealth.com.
Okay.
That's got a phone number on it.
Okay.
You can also go to Coastal Pearl.
Yes.
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 Yes. Go to Coastal Pearl.
Yeah, go to Coastal Pearl.
Okay.
You can find us there.
Perfect.
Right.
Yes.
And just book the appointment.
Okay.
Right.
And
And
you guys will take it from there once you
yeah,
book.
we take it from there.
Are you at the office usually or no?
I'm between there and the pharmacy we work with.
Okay.
We have a pharmacy with several that we work with quite closely. So,
Okay.
So
maybe he's a busy man.
Yeah. So I kind of rotate between there and
Okay.
Yeah.
Okay. Fair.
pharmacy.
Well, stop in. Thank you so much. This was really amazing. And it's just awesome. It's like the future of medicine is here, I'd say.
Yeah.
So
Absolutely.
thank you so much for joining us, Buck.
Well, thank you, Megan. I
Yes.
appreciate it.
Of course. And we will be back soon. Have a wonderful holiday season and New Year.
Yes. Merry Christmas.
Merry Christmas.